As we approach Labor Day, I'm excited to announce that the launch of a massive new drive to put the full force of the AFL-CIO and the entire labor movement and nearly 3 million union retirees behind winning, secure, high-quality health care for all by 2009.
Everybody knows of or has experienced a healthcare horror story. In this society, that is unacceptable.
My name's Mike Jackson. I've been an employee at Ohio Valley for about 28 years. I work in maintenance. We formed a union in August of '06. One of the main reasons was for the health care and health care coverage. The health care has actually, the coverage of it has actually doubled, if not tripled, in the last couple of years. The coverage has actually went down. Due to the reasons that we can't afford the higher premiums no longer. The emergency rooms, they've doubled and tripled in the last couple of years. The deductibles for a lot of these went from $500 to $5,000 depending on your case. Going to the doctor's office, it's doubled and tripled.
My name's J.J. Scott. I'm a truck driver at Ohio Valley Aluminum in Shelbyville. Worked there about 8 years. I pay approximately $600 a month for my health, dental, and vision insurance. The cost is to the point that it's unaffordable. Having paid this much money for insurance takes away from me being able to do extra things for my kids. This is why we formed a union in August of '06.
Hi, I'm Deborah Payton, and I'm a registered nurse here in Louisville, Kentucky. I've been a registered nurse for about 25 years, and I come from an old school where we focus on being patient-centered and goal-directed. Things have changed over the years. We moved into a for-profit hospital back in '83, and since then we've had more paperwork, less nurses, patients prematurely discharged, and they are in a revolving door where they come back in, not fully treated when they're originally there. So things have gone downhill. I'd like to see us get back to being like in the old school, patient-centered and goal-directed.
This commitment of the AFL-CIO is really important because what it does is to set as goals certain principles that have to be in any plan. And I think those are the appropriate goals. We need to cover everybody. We need to make it affordable. 50% of all bankruptcies are attributable to healthcare costs in this country. 50% of all bankruptcies. I can't tell you how many people we have talked to throughout this community who have had to sell their house, who have had to give up on food, you name it, just because they have healthcare costs that are not covered. Some of these people are even people who have health insurance. I think it's really critical that the union movement in this country be involved in this effort. I've said many times that one of the primary reasons we need to have a strong, organized labor movement in this country is because if we don't, nobody is going to be looking out for the middle class in this country. Nobody's going to be advocating for the middle class.